It's hashtag Webinar Wednesday. Thank you for joining us again. I'm Doug Sesserman, privileged to serve as the Chief Executive Officer of American Associates Ben-Gurion University of the Negev. It's noon Eastern time. I'm in my virtual office in New York City, and we're joined by Professor Nadav Davidovitch at 7 p.m. Israel, who's one of Israel's leading advisors on the coronavirus vaccine and also the director of Ben-Gurion University's School of Public Health. But before we get to Nadav, I just want to cover a couple of things. First, I just want to thank Melody Mokhtarian behind the scenes, Kara Bortman, also Ronnie Strongen, our former Chief Marketing Officer, for all her good work over the years, and Sari Berkovich, our new Director of Marketing. For those of you who are familiar with this format, the promise is that if you give us 30 minutes, this webinar is called for 30 minutes, we'll give you insight into one of Israel's most innovative universities and one of the institutions that are most vital to the future of the state of Israel, and some of us think the world. So thank you for joining us. Nadav and I are going to have a conversation. If you have questions along the way, just go into the Q&A function, type your question. I'll be able to feed those questions to Nadav. The first part will be Nadav giving a bit of a presentation on Israel's success, and then we'll move into the questions and answers toward the end of the program. Also, before we get going on this, if you love all our programs and just don't get enough, we have an incredible one coming up on April the 25th. Please join us for what we're calling Celebrating the Remarkable, a free virtual event where we will be honoring Dr. Ruth K. Westheimer as she receives her first and only honorary doctorate from a university in Israel, Ben-Gurion University. The degree will be conferred by the president of the university, Daniel Shamovitz, and also Chaim Hames, the rector. We'll also be recognizing Tony Young, who's just an extraordinary volunteer leader and our past board president, and Philip Gompertz, who recently retired, but is known as the professional steward of the largest donation in the history to Israel, the Marcus Endowment at Ben-Gurion University. So please join us on April the 25th. And with that, Nadav, you ready to go?
Yes, please.
Okay, great. So I'm just going to give the audience a little introduction of Nadav. Professor Nadav Davidovitch is, as I mentioned, the director of the School of Public Health at Ben-Gurion University of the Negev. He's also the chair of the Center for Health Policy Research in the Negev and an advisor to the Israeli government on coronavirus policy. He represents Israel at the European Public Health Association and recently became the interim chair of the Israeli Association of Public Health Physicians. Mazal Tov. Professor Davidovitch's research focuses on various aspects of health policy, combining his multidisciplinary training as an epidemiologist and public health physician with his research expertise in the sociology of health and public health ethics. Very interesting. He is involved in several research projects related to the legal and ethical aspects of public health practices, including pandemic response and health inequalities. He's also become a bit of a TV star in Israel for all his appearances on television during COVID-19. As a reserve medical officer during Operation Protective Edge in 2014, he was the commander of a medical unit with some 700 physicians, paramedics, medics, and other personnel. Professor Davidovitch received his MD and his PhD from Tel Aviv University and his master's in public health from Ben-Gurion University. Welcome, Nadav. That was quite a bio. You're quite a guy. And in addition to being a TV personality in Israel, I saw you on CNN the other day.
Wow, thank you so much. I'm blushing for presenting me. Probably the best achievement I have till now is being a grandfather, age of 45. I have now 2 grandchildren, and this is probably the best. And now we can see them also.
That's amazing. So you were telling me, I mean, let's just jump right into it. I know that Israel is almost 50% vaccinated with 1 dose, and among critical segments of the population is almost 30%. So how did Startup Nation become vaccination nation? How did you do it?
Great. So, Doug, we're saying always, wow, what happened here? That when you have a good question, you have a slide for it. Just a second. Here it is.
No problem. While you're looking for your slides, I just want to say thank you to our audience. We had over 170 people sign up. The audience keeps building as we're talking, so I'll stop talking or else the audience will dwindle. But go ahead, Nadav.
Thank you so much. So we just published a paper on British Medical Journal answering the question of the vaccine rollout. Just before we started the webinar, you asked me the question and I went to the Israeli dashboard. This is from February 14th. And, Doug, every day we have more and more people being vaccinated. Here you can see vaccination according to the different age groups. And you see that those who are above 60, and especially these groups, you can see that, for example, those who are 80 and 90 years old, almost 95% got one vaccine and about 80% got the second dose. And you can see here, this is the first dose. We are now, this is from several days ago, but now we are about 46% and rising. And you see that the UK and Bahrain, and you see where the US is. And this is for the second dose. I think this is maybe even more impressive. Again, you need to be very careful because, of course, the most important components being vaccinated are those who are high risk in terms of age and chronic conditions. So why the success of the Israeli rollout? And I think we need to understand that this is, a multi-layered story. So of course we have a national health insurance with 4 health plans. We have the health plans at Kupot Cholim that are directly employing nurses. And we have, the disadvantage of the private system, unfortunately, like in the US, it is very fragmented. This is not the case in Israel. We have very good electronic medical records. On the other hand, and this we must remember, Doug, that vaccines are amazing, but they're not going to solve the underfunded public healthcare system. This is probably a question of another webinar. It's something that I'm working also about the private-public relationship. So we're still lucky that, the roots of the Israeli healthcare system are very public. And you know what? In the 90s, when the Israeli parliament, voted for the national health insurance law, both Likud and Labour Party voted for it. Just imagine in the US that the Republican and Democrats vote together to have a single payer healthcare system. So public healthcare is something that is deeply embedded in our culture. So first of all, you need to have availability. And lots of things were discussed about, the role of Pfizer, but we need to remember Moderna. Professor Tal Zaks, the medical officer of Moderna, is a graduate of School of Medicine. And they thought
we're very proud of Tal and Moderna. And
sure. And Tal is going to have like an honorary degree, or honorary celebratory something very soon from
yes,
from
he
BGU.
received our Ben-Gurion award, and I believe he's also getting an honorary doctorate from Bar Ilan.
Right. Yeah, that's true. So we have a very an amazing electronic medical record system. Again, something that many countries are looking. This, of course, give us also the opportunity to conduct lots of research, including, of course, the BGU, population-based research. But this was also very important for Pfizer to have Israel as a model country. I want to emphasize, we are not guinea pigs. Phase 3 is over. The clinical trials are over. Now we are doing the post-marketing phase 4 trial. Observational study.
Nadav, I've got a question that came in from an anonymous attendee from Canada on this subject you're presenting. So I try not to interrupt too much, but this one's spot on. And by the way, thank you to all the Canadians, Israelis, and Americans who have joined us today for this talk. The anonymous attendee says, Canada has national health insurance, yet they have less than 4% of the country vaccinated. They don't even appear on your slide because they're doing worse than Indonesia.
Right.
So help us understand the role of national health insurance or public health versus not. Is that really the reason Israel's so far ahead?
So as I'm going to present, of course, this is not enough. You need to have the public system, but that's not enough. So the question of availability, so Israel invested people from the Ministry of Health, my colleagues, and by the way, also the Prime Minister. I mean, it's true. It's also for political reasons because we're going to have election. But when you have your Prime Minister invested, when you have the political will, this is also very important. And we need to say that in Israel, the question of privacy is less on the agenda like in the US. And this is maybe another reason why Pfizer wanted to do the post-marketing phase in Israel. But it's not just availability, Doug, it's also about provision. So we have the health plans, the sick funds, the Kupot Cholim, with the IT infrastructure, the electronic medical records. And we know, like in the periphery, that we have all the sick funds in Israel, in the Negev, it's mainly Clalit Health Services. We all know Soroka Medical Center, but also other ones. And they are employing nurses, so they could really rapidly, mobilize all those nurses to do the vaccinations. And also, and I was part of it, I served, as you mentioned, in the military. I was head of the epidemiology department many years ago. We did lots of drills about mass vaccinations because of our preparedness programs. So it's also about provision. And of course, another aspect that is crucial here is the question of compliance. So fighting fake news is really a very challenging project that we're doing now. We're talking both top-down and bottom-up initiatives. So the Ministry of Health, the Israeli Medical Association, you mentioned that I'm now again, after I did 2 terms of serving as the chair of the Israeli Public Health Physician Association, because the person who replaced me went to politics, so I now again volunteer to be interim. And you can see that the Israeli Medical Association and other NGOs are very engaged, but also bottom-up initiatives. You probably all heard about, giving cholent or giving falafel or pizza, or I know it sounds very funny, but sometimes when you created like a happening event and bringing all the community, that's something that is also important. And there were also WhatsApp groups at the beginning when the vaccines were just for the elderly. And you know that when you are taking them out of the refrigerators, you have certain amount of time. So people were calling, there are 50 vaccines here in Dimona, please come because otherwise they'll be thrown away. And there were those kind of WhatsApp groups. I just visited Doug.
Yeah, that's probably one of the big mistakes in the US. We've almost been too careful, right? So we've been so careful with a phased approach that we've ended up not being able to get all the vaccines in people's arms.
Right. I visited Doug last Saturday, Segev Shalom. It's a Bedouin town, a recognized Bedouin town. And I saw the energies of some also of our graduates, including a collaboration with the Arab physician, the Bedouin Arab Physician Medical Association in the Negev with Dr. Naim Abu Frecha. He's a gastroenterologist, but he's leading this association and is now, also talking everywhere. So these kind of initiatives were also extremely important. And here you can see, for example, the different tailored reach out for cultural minorities, such as ultra-Orthodox Jews and Arabs. We were working together with rabbis. Doug, I went to shows that I never even heard of about, like Kikar Shabbat. It's something that is for Haredi. I'm on a different radio. For every faction, kind of they have for Hasidic, for Litvaks, for this and that. And we were doing a lot of work with religious leaders, but also in the Arab community. So that's something also to remember. So to conclude for your question, so there were selected factors contributing. We mentioned the question of availability, so the early procurement, because Pfizer really wanted a country that is relatively small, with good IT and electronic medical records. But there are challenges here, and people are asking, about privacy and data protection, and this is an ongoing debate. One of my former PhD students Rachel Guru-Aryeh, I think she spoke on the ABGU also sometime. She got a very prestigious postdoc now with Johns Hopkins program on infectious disease bioethics. So she published now just an article on BMJ Global Health. I'm very proud of her. So the question of privacy and data protection is very important. The second aspect is provision. So the fact that nurses were deployed from other tasks to work after hours because it was delegated to the health funds, it is very important to mention. But again, there are questions, what about other work they need to do? So is it really sustainable? That's a major challenge here also to remember. It's not mentioned here, but provision also by Magen David Adom, by the MDA, they played a very important role in going to elderly homes, debilitated person. So, going to these places, it's very important. And the third layer is
the question that is the Red Cross, right?
It's equivalent of the Red Cross. I hope that maybe we are in a negotiation that have to have them affiliated to Ben-Gurion University. I hope it's not, I'm not, concealing some secrets, but we are negotiating with them. They're doing an amazing work. And you know that at BGU, we have a very strong preparedness program and also the paramedics program.
Correct. In our faculty, we have excellent emergency preparedness in our Faculty of Health Sciences. We not only create some of Israel's best doctors, but also emergency workers and nurses, et cetera.
Right. So in terms of compliance, the all infrastructure of the IT to make appointments. That at the beginning, first few days, it was overwhelmed, but later, things went very smoothly. And campaigns to reduce hesitancy, as I mentioned, with Cholent or Blinches in Petah Tikva. And indeed now we have, when about half of the population already with the first dose, now we have the challenge of bringing in, especially the young people. So we're talking about having the green standard. I don't like the term green passport, green standard. So when people are going maybe to a cultural event or sport event. So from next week, and I'm participating in the discussion with the expert committee, we thought that it would be really important to give a positive initiatives. I'm against compulsion, but giving sometime these kind of initiatives is very important, both on personal level, but also on giving initiatives, incentives, sorry, not initiatives, giving incentives for the health funds by giving them some extra bonuses for vaccinating above certain percent is very important. And you can also see, here I'll send you later the website, but you can see here the paper, the short paper we published about the role, short-term success and question for the long run. It was published. I'm one of the authors, and also Ruth Weisberg, a PhD student. She's doing a joint PhD with BGU and the Health Policy and Management Department in Berlin. So we have also a very international community of students. She's also working for the European Observatory on the health policies. And here it's a very important issue for me to say. I'm a member of the Association of Schools of Public Health in European Region COVID-19 Task Force. Ben-Gurion University School of Public Health was officially accepted about a year ago. And we issued a statement, and all public health community in Israel thinks that it is both the right of a Palestinian to be vaccinated, but also it's for the best of Israelis. Because, we are finally in the same neighborhood, and if we want to get into herd immunity, it's very important. I know for sure that Director General of the Ministry of Health, Professor Chazi Levi, by the way, a faculty in the School of Public Health. He was the previous director of Ashkelon Barzilai Medical Centers. He's now the Director General. Professor Nachman Ash, who is running now the whole COVID-19, and Professor Itamar Grotto, another faculty from the School of Public Health, are all supporting this. It's a political issue that I hope we're going to solve. There are issues of Palestinian in Israeli jails that are finally vaccinated. And this is something that we still need to figure out. So this was a kind of a short presentation. So I hope I gave you some answer why we are successful, but also the challenges. So there are different reasons, Doug. It's not just one issue. And again, the example of Canada is telling us that it's not enough to have a public healthcare system. It's important, crucial, but you need to have also the availability, you need to have the provision, and you need to have compliance. And all of that, it's not an, like an anecdote or something that just happened. We worked very hard for it to happen throughout the years and also now.
Very good. And while you were talking, our audience has been growing and we're blowing up with questions. So let me try to get to some of those. Brenda Zlayton, who's a good friend and supporter with the Blaustein Institute. She's asking if you could explain more specifically about the Israeli Arab public's hesitation to be vaccinated.
Asking about, sorry, who's hesitant? I couldn't hear.
Why would there are two parts of the population in Israel that we've had, it's been slower to get vaccinated, the Arab Israelis and also the Haredi, the ultra-Orthodox. Could you just speak to why the Arab Israelis less likely to be vaccinated?
So both the Arab and the ultra-Orthodox are, of course, not a monolithic group. So there are a variety of reasons. At the beginning, especially for the Arab community, it was a question of access and availability. It took some time. I'm talking like a 1 or 2 weeks lag until many of these clinics, vaccination clinics, were open also in the periphery. But then there were lots of fake news. And at the beginning, at least, many of the ways of, most of things that the Ministry of Health did were in Hebrew. So it took some time to translate and to take the right figures to convince them. So this was a challenge. And some of them, again, it's not monolithic. Some people in the Orthodox community, they are kind of even anti-Zionist, not all of them, some of them. Some are neutral, some are Zionist. It's a complex society, like every society. So for some, both in the Arab and Haredi community, it was an issue about trust in the government. So this was also a major thing.
Thank you. We've gotten lots of questions, so thank you, audience, for the participation. We've got a question, they're related, so I'm going to try to combine. This is from Andrea Gorin, who's our board treasurer, and also Ahmad Abu Al-Halawa, if I'm pronouncing it correctly. Andrea is asking about the numbers you were presenting. Do those represent Palestinians who live in the West Bank, or is that just inside of Israel? I assume those lines are just, those percentages are just Israel. So the question is, what is Israel doing to help support vaccination rollout in the territories?
Right, so the number presented that, of course, all people living in Israel, including sometimes they're called Arab Israelis or Palestinian Israelis. As for the territories or the West Bank and Gaza, as I mentioned by the end of my presentation, short presentation, all the public health community is supporting procurement of vaccines. It's still an ongoing debate. Israel gave several thousand of them. Israel is also signed on COVAX. COVAX is an agreement by the World Health Organization to give countries of low and middle income vaccines. I really hope there are negotiations right now, and I hope that by next week I have good news. We just published today, the Israeli Public Health Physicians Association, a very lengthy article explaining why, both from moral reasons and from public health reasons, we need to have the Palestinian people vaccinated.
Thank you. We're getting a couple of questions related to how vaccinations actually starting to impact the pandemic. And I know Israel has a blended strategy. You're also, I don't know if you're still in the lockdown, but you closed the airport. So from a public health management perspective, can you just talk about how you blend the strategy of vaccinating with also lockdown and other approaches to try to control the pandemic?
Right. So this is a very important question, and this is also part of our discussion in the expert committee. So we need a blended, or I would call maybe a multi-layered approach, based not just on vaccination, because we cannot get to herd immunity because children won't get the vaccine until then. This will be approved, and this will take several months from now at least. So we are still having masks. We are still working on preventing mass gatherings, and this is a challenge, especially in some of the communities. We mentioned ultra-Orthodox, so there's the question of Purim coming. Also this Shabbat, those of you who know, it's a Shabbat Zachor. Zachor is a portion of the Torah that everybody, including women, need to listen. So there are special arrangements for that. We have what is called Education Shield about pooling testing in schools. And actually, we are going out very gradually. I hope this time, not like in the first and second lockdowns. And the next week from Sunday, there'll be more opening in terms of finally implementing what is called the green standard. So people that are vaccinated, second dose 1 week from that, and also people that recovered can enter in a certain conditions, events like maybe cultural events or museums. And schools will be open only for elementary school and those who are on 11th and 12th grade because they can vaccinate and doing the matriculation exams. So it's still an ongoing challenge. We cannot get to herd immunity, but we see already, as for your question, a major success, especially above those who are above 60. We see that the number of severe cases and deaths in the 60 years and older is really going down. And now we have more cases, unfortunately, in those who are 40 and 50 because we have the UK variant and other variants that are spreading very fast. So we're still, in the midst of the turmoil, but we can start to see, in Hebrew, there's a saying like the light in the corridor. I don't know how it's in English.
Light at the end of the tunnel.
Yeah, exactly.
Which is just a long corridor. We're getting a question from an anonymous attendee that's just asking your opinion. If you've had 2 doses, is it safe to go to synagogue?
So in Israel now, only from Friday, we're going to open again synagogues, but only for 10 people in one space inside. I would prefer being outside. I was raised as a religious person. I was a chazan for 20 years, and most of my family is still religious. And I did also on the high holidays, I was davening outside. I think it's actually great. There is a saying about Isaac, Yitzhak, our forefather, that that Isaac went to the field and the Rashi is saying that he was actually praying Tfilat Mincha. So I think that praying outside is beautiful. Of course, in Israel, maybe not today because it's really raining and there's even snow in Ramat HaGolan and Jerusalem, but in general, temperature, especially, Beersheba or Tel Aviv, are more in the 60s. So you can go and daven outside. In the future, there'll be maybe checking also about this green standard. There are discussions about that. And I think that, again, especially people that are not vaccinated should wait, but also people that are vaccinated, if you can daven outside, it's probably preferable right now.
Thank you, Nadav. So that 30 minutes flew by. We still have so many questions. I know you have another appointment, so let me just close with one question. A couple of people are asking about travel to Israel. Do you believe it? Do you have a date and when when it will be safe and everything, people can travel to Israel like they used to?
Wow, this is a tricky question. I don't, there's a saying in Hebrew about prophecy. I think that it will take some time. There are now bilateral agreements signed by different countries about vaccinations. I think that probably more towards the summer. But it's a guess, it's really hard to tell.
Okay, thank you, Nadav.
Okay.
So again, please join us, audience, on April
God.
the 25th for celebrating the remarkable David Ben-Gurion, the founder and first prime minister of Israel, and the guy whose name is on the door of our university once said that if an expert says it can't be done, find another expert. But today we had a wonderful expert in Professor Nadav Davidovitch. He had to run to another appointment, but we thank him for his participation. And I just thank the audience for joining us. Thank you and be safe.